Let me ask you a question. If somebody faints every month, if somebody throw up or vomits every month, if somebody skip work every month, or somebody misses school every month, is that normal? So why do we call it normal when it happens every month during someone's period? Today, we'll be breaking a very dangerous myth. Period pains are not always normal. Period. Hi, beautiful people. I am Esther, a physiologist and healthy lifestyle advocate, and I talk about things many people are too shy to explain properly. And today we are having a very honest conversation, so take your seat. Because many women have been told it is normal. That's how period should be. Just take painkiller and sleep. Before you wake up, you'll be fine. Or some persons will even tell you after childbirth, the pain will stop, though you'll be fine. But let me tell you something clearly. Pains that disrupt your normal daily activities are not normal. Let me tell you one reason why a lot of us normalize pain. Because from teenage age, many of us girls were told, welcome to womanhood. This pain is part of being a woman. So we grow up believing that words that they keep telling us. We grow up believing that rolling on the floor during your period is normal. We grow up believing that missing school during your period is normal, or not going to work or doing anything in the house during your period is normal. Vomiting self during your period is normal, or using different type of painkillers during your period is normal. But note that just because something is common doesn't mean it's healthy or is normal. Let me tell us actually what normal period pain is. Mild period pain is normal. Why? Because during period, your uterus contracts to pull out the lining. These contractions are caused by prostaglandins. What is normal also is mild abdominal cramp. What is normal is slight back pain. What is normal is managing the mild pain with little or mild pain relief. What is normal is that during your period, you can still function. You can still go to school. You can still go to your work. You can still do your normal activities. These can be classified as normal period pain. But you see, when you stop going to work, you stop going to school, you miss activities, even things you love doing, you stop doing them just because you are in your period, it is not normal. Let me tell us that some persons, their pain can even lead them to being admitted in the hospital. A lot of them start bedridden simply because they're in their period. Those pains are not normal. Let's talk about 7 warning signs that that painful period is not normal. Leaning, come closer, let's discuss that. One of them is pains that get worse every month. When each cycle feels intense more than the last cycle, that could suggest something progressive, in most cases endometriosis. Endometriosis is a condition which causes tissue similar to the uterus to grow outside the uterus, and it can cause severe pain. Another one that is not normal is pain during sex. Painful intercourse is not something you should just manage quietly because it might be pointing to endometriosis. It might be pointing to pelvic inflammatory disease. It might be pointing to pelvic infection because your body is not designed for constant pain. Another one is heavy bleeding. When you have to be changing pads every 1 to 2 hours during your period, it is not normal. Or when you start having large clothes, or when your period lasts more than 7 days, it is not normal because it might be linked to uterine fibroid. Another one we'll be talking about is fainting and vomiting. Yes, prostaglandins can cause nausea, but you see constant or repeated fainting, it is not normal. This is not something you should ignore during your period. The fifth one you shouldn't ignore are pains that start before your period. A lot of persons experiences 3 to 5 days pains before their period, and most times even when the period starts, the pain continues. This is not a typical mild cramping. Another one you should not ignore is severe leg or back pain. Some conditions even affect nerves in the pelvic, causing shooting pains down the leg. This is not just mild cramping. You should not ignore it. Another very important one, the seventh one, is difficulty getting pregnant. Painful period combined with infertility can be pointing to one, endometriosis. It can also be pointing to polycystic ovarian syndrome, PCOS. It can be pointing to fibroids. So what could be causing all these pains? What could be causing all these pains that one experiences during period? One, endometriosis. We keep calling this endometriosis because it's very common. One of the causes of this severe pain is endometriosis. Another causes of this pain is uterine fibroid. Another causes of painful period is pelvic inflammatory disease. Another one is polycystic ovarian syndrome. Another one we are just adding is adenomyosis. Yes, this can be the cause of that painful period. These are medical conditions, not exaggerations, not weakness. Why should you not ignore these signs? One, because when you ignore it, it might delay diagnosis. It might even affect your fertility in most cases. If ignored, it might cause chronic pelvic pain, and it can even affect your mental health. These are reasons why you should not ignore this pain when you experience them. The funniest part is a lot of women with endometriosis, they get diagnosed after 7 to 10 years, 7 to 10 years late, just because somebody have told them your pain is normal. So what should you do if your period pain is not normal? One, track your cycle. Secondly, try to identify the severity of the pain. Put it on a scale of 1 to 10. How severe is the pain? See a gynecologist if you have to. Request for proper evaluation. Go for scan. Go for hormonal check if possible. Advocate for yourself. Don't wait for someone to push you. Advocate for yourself and get the right treatment that you deserve. And let me shock you, in most times when you go to the hospital, the doctor might even dismiss you saying that the pain is normal. Please, if a doctor dismisses you, go for a second option. Go to another hospital.
Please, if you watched to this point, don't forget to share this video with your friends. Don't forget to share with your sister. Don't forget to share with your daughter. Share to even your enemies, because they need to know that these pains are not normal. And most importantly, also put on the comment section if this is you and this is the first time I've seen this kind of video and you've been normalizing pain for a while. Put on the comment section, I thought is normal. Let's know women that have been normalizing pain. Let's learn and do better. And also don't forget to subscribe to this YouTube channel and also turn on your notification bell, because we upload health related videos every week. Most importantly, any pain that disturbs your normal activity is not normal. So sorry, we don't know what happened to the audio of this sound. We have to use voice note to add. See you in our next video. Bye.